Hello, I'm Shocky Shark, MD, the doctor who's going to be interviewing you today. Please call me Bruce. It's what my friends call me. Please introduce yourself.
Hi, my name's Aurora. I just finished nurse practitioner school and I'm trying to be a nurse practitioner here.
I'm just going to ask you a few questions. What is the scope of practice of an NP versus other providers?
After meeting the requirements, nurse practitioners can practice independently, prescribe medications, including controlled substances, and are recognized as primary care providers in women's health or gender-specific health, family health, and caring for patient across the lifespan of the patient, mental health, adult health, gerontology, pediatrics, neonatal, and any other population of focus approved by the board. Other providers, such as PAs or dental hygienists, are required to practice under a supervisory licensed physician or provider for either part of the day or entirely.
Hi, my name's Vegas, and I am a dental hygienist. I may apply for a special endorsement, in which case I would be able to practice independently, but I would still never have any prescribing authority.
Hi, I'm Bo, and I'm a physician assistant, also known as a PA. I can practice for at least part of the day with a provider, but I can't practice like by myself all the time. I have to have a physician available to me at all times. Even if the provider is available by telephone, that's okay. But I'm not allowed to prescribe any medication without his approval.
My name's Bungle, and I'm a chiropractic physician. While I'm still considered a physician, I am not allowed to prescribe medications, perform surgery, puncture the skin, not treat non-human animals, which that's not me, or practice without malpractice insurance, all right?
How does your focus of practice change in an advanced role?
According to a book I read, clear goals and objectives, results-driven structure, competent team members, unified commitment, collaborative climate, high standards, external support and encouragement, and principled leadership are all characteristics of a group of team who were able to have shared visions and goals. The focus of practice changes from a standpoint of curing/caring, because the physician's goal is to diagnose and then cure the patient, and the goal of the nurse practitioner is now also to diagnose and treat the patient. However, coming from a nursing standpoint, our values are based thoroughly through our code of ethics and our foundation of caring for our patients. While nurse practitioners are now treating and diagnosing, it is in our nature to still have a caring soul and heart, and we bring that with us to the bedside. After all, it is our calling, according to Florence Nightingale, the mother of all nurses.
How can nurse practitioners maximize their value in clinical practice?
An article states, "There is a heart and soul to nursing, and the code illuminates who we are. One thing that does not change regardless of title or scope are the patient's rights and the idea of doing what is best for each patient on an individual level and basis. When nurse practitioners are utilized appropriately, they can increase the availability of providers to the community at large. Utilizing nurse practitioners for primary care checkups and follow-up routines save the physician's time and saves patients money because nurse practitioners are more affordable. By utilizing the ANA Code of Ethics for Nursing, the nurse promotes, advocates for, and strives to protect the health, safety, and rights of the patient. Nurse practitioners can be a great asset to a healthcare team."
What are your core values of nurse practitioner practice or of nursing education that will enhance the interdisciplinary team's work?
Some core values include, but are not limited to, care, compassion, competence, communication, courage, commitment, respect, dignity, getting the basics right every time, improving patient lives, patient involvement, honesty, trust, accepting, open-mindedness, teamwork oriented, similar goals with patient-centered care and healing.
What theory or theories demonstrate the nurse practitioner's unique approach to primary care?
Gene Watson's Caritas caring theory, which includes the 10 Caritas. I'm going to go over them because they just mean so much to me. Sustaining humanistic, altruistic values by practicing of loving and kindness, compassion, and equality with self and others. Being authentically present and enabling a faith, hope, belief system honoring subjective inner life world or self of others. Being sensitive to self and others by cultivating own spiritual practices beyond ego, self, and transpersonal presence. Developing and sustaining loving, trusting, caring relationships. Allowing for expression of positive and negative feelings. Authentically listening to another person's story. Creatively problem solving, solution seeking through caring process. Full use of self and artistry of caring healing practices via use of all the ways of knowing, being, doing, and becoming. Engaging in transpersonal teaching and learning within context of caring relationship. Staying within others' frame of reference, shift towards coaching model for expanding health and wellness. Creating a healing environment at all levels. Subtle environment for energetic, authentic, caring presence. Reverentially assisting the basic needs as sacred acts, touching mind, body, spirit of other, sustaining human dignity. Opening to spiritual mystery unknowns and allowing for miracles to happen.
What care models best utilize NPs as providers?
Some other good care models which nurse practitioners can utilize would be, off the top of my head, Gene Watson's theory of human caring, the quality caring model, the middle range theory of caring, relationship-based care. These all include evidence-based as well as family and patient-centered care as a priority of focus. This is of utmost importance when it comes to taking the responsibility of caring for patients and their families in a nursing leadership position. However, there are many nursing care models that are beneficial to patient care which are not named here. But as long as values are incorporated into patient care with a patient care-centered model, I know that patients will be in good hands and be empowered to make good, healthy choices for themselves and their families.
Okay, this concludes your interview. HR will be in touch with you soon. Thank you. Have a great white day.
Thank you, Bruce.